In this audio notes, we'll be looking at a few topics, and they are IgA, Mycobacterium tuberculosis, Hepatitis B Markers, Tetanus, H. pylori, and the transport medium. And firstly, we'll be looking at IgA. So IgA is the second major serum immunoglobulin, and it has a half-life of about 7 days. It can occur in two forms, that is serum IgA and the secretory IgA. The serum IgA is a monomeric 7S molecule, whereas the secretory IgA is a dimer, and this dimer is joined by J chain, and J chain is nothing but a glycoprotein, and this J chain is joined at their carboxy terminals of the monomeric units. And this secretory IgA and the J chain, they are mainly produced by the plasma cells, and there's also another piece which is present, that is known as secretory piece, or also known as S piece. This S piece is synthesized by the mucosal or the glandular epithelial cells. It attaches the IgA molecules at their Fc portion, and when we see where is this IgA present, it is mainly present in the secretions of the milk, saliva, tears, sweat, nasal fluids. It mainly protects the mucous membrane against microorganisms. IgA, it also plays a role in activating the alternate complement pathways. It is mainly synthesized by the plasma cells and also by the serum. There are two subclasses of IgA, that is IgA A1 and IgA A2. IgA A2 is more common, and it is devoid of the disulfide bond which is present between H and L chains. Moving on, next we'll be looking at Mycobacterium. So under Mycobacterium, the main important organism we'll be focusing on is Mycobacterium tuberculosis. So under this Mycobacterium, we need to know that it is acid-fast bacilli. That is, it is difficult to stain, but once stained, it is difficult to decolorize it. So talking about the main species of tuberculosis, there are 7 species of tuberculosis which affects mammals. That is mainly Mycobacterium tuberculosis, Microti, Capre, Bovis, Africanum, Pinnipedi, and Caneti. So just going a brief about the morphology of Mycobacterium tuberculosis. It is straight or slightly curved bacilli, and it has a size of 3 into 0.3 micrometers. And some bulletin points you need to know is that it's acid-fast, non-sporing, non-capsulated, non-motile, and it is stained by Zn staining, that is nothing but Ziehl-Neelsen staining. And under the Ziehl-Neelsen staining, it appears bright red under a blue background. So also a fluorescent dye such as auramine O and rhodamine can be used, and it appears yellow luminous bacilli under the fluorescent microscope. It can also be stained using the Quignon's method of acid-fast staining. Here what happens is that heating is not required. It is also known as cool staining method. And the carbon fusion which is used, it has a higher concentration of phenol, which is seen in case of Quignon's method. Talking about the culture, LJ medium is most commonly used. This medium, it mainly consists of beaten eggs, aspergine, mineral salts, malachite green, glycerol or sodium pyruvate. It is solidified by heating, also known as inspissation. And in this medium, I'll be talking about the importance of all the contents. That is, egg is used as a solidifying agent. Malachite green, it inhibits growth of organisms other than Mycobacterium, and it also acts as color, as the name suggests. And also presence of glycerol, it improves the growth of human type of Mycobacterium tuberculosis. Sodium pyruvate, it also improves the growth of Mycobacterium tuberculosis. And talking specifically of Mycobacterium tuberculosis, the colonies, it appears dry, rough. It is raised with a wrinkled surface. Various other methods that are used, culture medias, are as mentioned earlier, LJ medium, Petragnent Dorset egg medium, Middlebrook 7H10, Middlebrook 7H11, and also liquid media such as Dubose media and Middlebrook 7H9 can be used. Moving ahead, we'll be talking about some of the pathogenesis. As we know, in case of respiratory infections, it is mainly transmitted through inhalation of infected droplets. Same is the case with Mycobacterium tuberculosis. And in case of bovine tuberculosis, they are excreted in the milk. So the individuals consuming the milk can also be susceptible to these species. These microbacterium, these bacilli, they are engulfed by the macrophages, but they are able to survive even after engulfment, and they have a capability to infect other macrophages as well. The CMI, that is nothing but the cell-mediated immunity, plays a major role in case of infection by mycobacterium. The CD4 helpers T cells, they secrete interleukin 2, tumor necrosing factor alpha, interferon gamma, and play a major role in providing immunity. Talking about the two types of tuberculosis, that is primary tuberculosis and secondary tuberculosis. In primary tuberculosis, the tubercular bacilli that is inhaled is engulfed by the alveolar macrophages, and they result in formation of a complex known as gonfocus, and this is frequently found in the lower lobe, and some of these bacilli, they are also transported to the hilar lymph nodes, and these gonfocus along with the enlarged hilar lymph nodes forms nothing but the primary complex. Moving on to the secondary tuberculosis, it is caused by the reactivation of the primary lesion. It is mainly found in immunocompromised individuals, and unlike the primary tuberculosis, it is mainly found in the apex of the lungs. And here there is also tissue destructions that is seen. Caseous necrosis can also be seen. And here the blood vessels are ruptured, and there is easy spread of mycobacteria through the body, releasing organisms in the sputum. Moving on with the laboratory diagnosis, there's tuberculin skin test. It works on principle of type 4 hypersensitivity reaction. There are few reagents that is used, that is old tuberculin and also purified protein derivative. Then there's also Mantoux test. Mantoux test is administration into the flexor aspect of the forearm, and it is given intradermally. So in case if there is a hypersensitivity reaction, it can be seen to the naked eye. Then there is Heave test. This is done with multiple puncture apparatus. So undiluted PPD is applied and the multiple puncture apparatus is pressed upon that. And talking about the result of the test, that is in case of Mantoux test, result appears after 2 days. In case of a positive test, there is presence of local edema along with erythema. There can also be false negative test in case of miliary tuberculosis and also in case of Hodgkin's disease, which was earlier discussed in the pathology, and also sarcoidosis, lepromatous leprosy, malnutrition, and corticosteroids. False positive can also be seen in case of atypical mycobacteria. The specimen that is mainly collected in case of doing the laboratory diagnosis can be CSF, can be urine sample, aspiration of fluid from the bones and joints, and biopsy of the tissues. In case of pulmonary tuberculosis, the sputum is collected. And in case of children, the gastric washings are generally corrected. And in case of meningitis, CSF fluid is collected. Renal tuberculosis, urine. In case of bone and joints, aspirated fluid. In case of tissue, it is biopsy of tissue. So direct microscopy can also be done, as mentioned earlier, that is Zn staining can be used. So under the Zn staining, there are a lot of categories, gradings, that is 0 to 300 fields. Acid-fast bacilli is not seen. 1 out of 300 fields means it is doubtful and it needs to be repeated. In case of 10 out of 100 fields, the score of 1 plus is given. In case of 1 to 9 out of 10 fields, 2 plus is given. In case of 1 to 9 per field, 3 plus. 10 or more per field, 4 plus is given. Smears can also be stained with fluorescent dyes, as mentioned earlier, by auramine O or auramine rhodamine, and is examined under ultraviolet light. There is also a recent use of LED fluorescent microscopy, which is found to be more effective. And the main thing that needs to be noted is concentration of specimens. It is done for homogenization of specimen, for decontamination, and also for concentrating the bacilli. Using under concentration specimens, there is Petrow's method. It is a widely used method, and here the sputum and the sodium hydroxide are mixed and is centrifuged, and it is neutralized by HCl, and indicator phenol red is used. Other methods that can be used for concentration of these specimens are N-acetyl L-cysteine along with sodium hydroxide and pancreatin. Moving on to the animal inoculation, a few amount of concentration specimen is given into 2 healthy guinea pigs, and it is through subcutaneous route, and it results in local ulcer. And these animals are weighed before and after. So in case of positive individuals, there will be significant weight loss. And in case if you're given a chance to perform an autopsy in an individual suffering from Mycobacterium species, you will mainly see caseous lesion. The inguinal lymph node is enlarged. Tubercles may be seen in the lungs, liver, and also the spleen, and the kidney will remain unaffected. The confirmation is mainly done by acid-fast bacilli from the lesions, and molecular methods, mainly the PCR is used. It is a rapid method, and PCR, as you know, it is used for amplification of the DNA, and there is also gene expert that can be used. It is a automated diagnostic test. The DNA sequence is noted, and also other methods such as ligase chain reaction, transcription mediated amplification can also be used. Chromatographic methods such as thin layer chromatography, gas liquid chromatography, high performance liquid chromatography can also be performed. And in serology, mycobacterial antibodies can also be seen in patient serum. So here ELISA, RIA, that is radioimmunoassay, and latex agglutination assay can be employed. And several antigens that have been tried are antigen 5,6, 64 kDa, antigen 60 and 32 kDa, and also BCG. Next, we'll be looking at Hep B markers. So the main Hep B markers are HBsAg, HBeAg and HBcAg. HBeAg, as we all know, it is the first marker that appears in the blood after infection. It is detected even before the elevation of transaminase and even before the clinical appearance. It is detected. It is seen mainly in the pre-icteric phase of the disease, and it remains in circulation throughout the symptomatic course. And upon recovery, this HBsAg, it disappears, and it can remain in patients, in carriers, for a long period of time. And then moving on to HBeAg, it appears at the same time as the HBsAg, but it disappears early. It is less infective compared to that of the HBsAg. In case of disappearance of HBeAg, there is appearance of anti-HBe. Then moving on to HBcAg, it is not detectable in the serum, but it can be demonstrated in the liver cells, mainly by immunofluorescence. The anti-HBc is predominantly IgM type, but later it is mainly IgG type. The IgM indicates recent infection, whereas the IgG indicates remote infection. Next, we'll be talking about tetanus. It is caused by Clostridium tetani, as we all know. It is mainly found in the soil and also the intestine of the man. And talking about morphology, it is gram-positive. It has a drumstick appearance. It is non-capsulated and motile with a peritricate flagella. Here the young cultures are gram-positive, whereas the old cultures, they show gram-negative. Talking about pathogenesis, they are mainly found in the soil, dust, and also feces. And here infection, it occurs and is localized only at the site of wound. And in case of germination of spores and toxin production, the disease is seen. The main result is that it results in muscle rigidity and spasms due to the simultaneous contraction of the agonist and antagonist, and the synaptic inhibition is blocked in the spinal cord. In case of laboratory diagnosis, the wound swab is mainly taken along with exudate of or tissue from the wound. Culture is taken. It is prepared inoculated in the blood agar. Toxigenicity test is also performed. Prophylaxis, they can be surgical, that is nothing but removal of foreign bodies and blood clots. In case of antibiotics, they inhibit the bacilli and other bacteria, and also immunization can be performed. Next, we'll be talking about H. pylori. Laboratory diagnosis is mainly performed by biopsy of the gastric mucosa, and also direct microscopy can be done, that is gram staining, hematoxylin eosinal staining, that is H&E staining, and also orthin starry silver staining can be done. And in case of WS silver staining, it is most clearly seen, and also antigen detection can be done by enzyme immunoassay, and inoculation can be done in chocolate agar and Campylobacter selective medium. Biopsy urease test is performed, and also urea breath test is performed. In biopsy urease test, the pH is changed due to the production of ammonia, and here the mechanism is that the urea is broken down to ammonia in presence of the enzyme urease, which is produced by the organism. And in case of urea breath test, the principle is that more CO2 is produced. That is, in case of H. pylori in the stomach, there is more production, this conversion of urea into ammonia and carbon dioxide. And serological tests such as ELISA and indirect immunofluorescence antibody can be performed, and also PCR. And treatment of H. pylori is done by combination of tetracycline, metronidazole, and also bismuth subsalicylate, and also omeprazole, clarithromycin can also be administered. Some important biochemical reactions that should be known in case of H. pylori is that it is urease, catalase, and oxidase positive. Moving on, transport media. Transport media is mainly used for organisms such as the gonococci, and major examples of transport media are the Stuart transport medium and the buffered glycerol saline transport medium. The buffered glycerol saline transport medium is used for enteric bacilli, and the Stuart transport medium, it is used for organisms such as the gonococci. So talking about the main use of transport medium, here it's known as transport medium. They cannot survive the time that is taken for the transit and are used just for delicate organisms, and also to prevent the overgrowth by non-pathogenic bacteria such as the cholera. Thank you.